Healthcare is a leading cause of bankruptcy in the United States. There's like 250,000 GoFundMe accounts for healthcare annually. The business model for healthcare is profit maximization, which is not bad. But if it is, let's be transparent with the numbers, right? And we're not.
The way the reimbursement happens in our country right now is what we call a fee-for-service model. So the more patients I see, the more procedures that are performed, the more revenue is generated. What we are really trying to do is start to push the reimbursement model to be one into what we call value-based care.
If we move towards value-based care, we're setting incentives that reward physicians and hospitals for delivering high-quality care. For example, rewarding primary care doctors for making sure that their patients have low cardiovascular risk, making sure that they get their cancer screenings, all these types of things that we know lead to improved health and hopefully lower expenditures on more severe disease further down the road. Over the last 20 years or so, the cost of health insurance premiums in the United States have risen close to 300%. That's the cost of a family insurance premium. Over that same period of time, workers' earnings have increased, but they've only increased 100%. So healthcare insurance premiums are becoming an increasing burden on the middle-class working household.
Hospital costs are the largest expenditure for employers, representing about 40 to 50% of their healthcare spend.
They therefore are not able to offer competitive wages because they have to be allocating a significant portion of their expenditures towards paying for health insurance for their workers. When that happens, we're not competitive with other cities or countries that are able to control their healthcare costs. What is important about Houston and every major city is the wide disparity in prices that you will find amongst providers. The prices can vary by as much as twofold, some cases threefold. Right now, when a patient is told by their doctor that they need a complex test or a complex surgery, they usually just rely on what the physician tells them in terms of where they should go to get that care. But price isn't put into the picture in part because many employees have health insurance where they pay an extremely small portion of the cost, so they're not concerned so much about that.
Value, if you look at it, it's a function of cost and quality. Well, the consumer is hidden from the cost equation there. Most of the cost is borne through premiums. They recognize the impact with premiums, but the employer bears a lot of that. Their co-pays are minimal often.
The problem is if every single worker automatically goes to their provider, and some of those providers are extremely expensive, that then drives up the cost for everybody involved, and it leads to higher health insurance premiums in the coming year for all of us. Increases in costs lead to more people not being able to afford health insurance, and so they are completely uninsured. It's leading to more people being underinsured. They face extremely high deductibles. Unfortunately, it's leading to a substantial number of households who are now facing medical debt.
We are all working in these systems that have systematically excluded certain populations, which is part of the big reason that we have some of the health disparities that exist. We really need to create new systems, right, that are fair and equitable. So in order to create those new systems, we have to be innovative.
And innovation occurs in many different ways across healthcare. It occurs in how we deliver care. More importantly, it's occurring in who's delivering that care and in what setting.
Our healthcare system isn't just made of the large consolidated systems you see, for example, in the Texas Medical Center. We depend on smaller clinics that are closer to the community, either in these rural outlying areas or in some of the underserved areas that we have in Houston. These are places where we can put primary care doctors in place to see patients where they need care. Working in primary care is not always profitable. It's not the big money maker of the healthcare economy, but it's the backbone. It's what keeps patients healthy, and it's these experts who can then refer patients on to specialty care when they need it.
At our clinic, the lowest fee is $35 for an office visit, and our highest fee is $85. We really take into account how much the family makes and how many family members need to be sustained by those funds, and we charge accordingly. We do get some funding from the federal government, the patient pays some, and then of course we have some private funding, and I think that's quite an amazing way of building community.
Really thinking about how do we make sure that every individual in our community has that access to a primary care physician. How do we make sure we have providers that represent the communities that we now live in? So making sure that we have more underrepresented minorities, more women, more LGBTQ plus providers, so that they can serve and are representative of our entire population so that people feel comfortable.
Walking through that waiting room, you can see people from everywhere in the world. The priorities of the community, especially the new immigrants, revolve around their financial stability. So making sure that they can have all the resources to address their healthcare needs so they can start working is their number one priority. For the uninsured patients, of course, if they don't have easy access to clinic like ours, they'll end up at the ER and they won't have a way of paying those bills. And they will be also clogging the system because they will be seeking care for things that could have been easily treated at clinics like ours.
I had an infection in my eyes, and it was deteriorating because I was delaying going to a doctor because I didn't have medical at that time. And somebody asked me about San Jose Clinic, and I went there. I had no appointment. I just walked in, and I couldn't believe they gave me such a fantastic treatment. That probably prompted me when I joined India House to give this kind of medical help. And we have our clinic, a charity clinic, every Saturday, and we provide health to anyone without insurance.
As we think about equity or health equity, community providers such as San Jose Clinic, our Hope Clinic, and others are performing essential care as part of the larger safety network here in Houston.
And I think our health insurance system needs that kind of help.
Health equity is so critical to St. Luke's and to Common Spirit. Really is that it's foundational to our mission.
Our mission was founded on caring for all, including the vulnerable in our communities, and we are committed to leading the nation in providing access and equity in care delivery. We know that we cannot do this alone, so we are here to partner and collaborate with other community providers, the City of Houston, employers, and others in the transformation to value health to make sure that everyone has access to care, no matter their location or socioeconomic status.